Welcome to Myo 360, the podcast, where we'll delve into all topics related to myofunctional therapy, including airway health, snoring, TMJ, tongue ties, thumb sucking, and even bedwetting. As a myofunctional therapist and a formal dental hygienist, I am sharing stories and tips to help you identify if myofunctional therapy is right for you and how it works to improve your overall health. Join us while we explore the ever-growing world of myofunctional therapy. We have one goal in mind: to help you and your family live your best life. Hello and welcome to another episode of Myo 360, Holistic Solutions for Snoring, TMJ, Better Breathing, and Better Sleep. I am your host, Becca Rose from Myofunctional Pathways. Today, let's dive a little deeper into nasal congestion and mouth breathing and why they play such a big role on your overall health. So, it may be more serious than you think if you're breathing through your mouth all the time. Today, we're going to deep dive into the nose, okay? It's important to understand why the nose breathing is so important to our health. We'll also explore how myofunctional therapy can help you regain the power of your nose. For many of us, a stuffy nose or an occasional mouth breathing episode might feel like an annoyance, a minor annoyance, right? For others, chronic congestion and mouth breathing is their normal 100% of the time. That's all they know. For a habitual mouth breather, there's no other way. It's gotten that way because the nose lost some of its function, its ability to work. It's likely that the mouth breathing started very early in childhood. Maybe it was caused by a cold or allergies that went untreated, and they just start to get worse and cause more inflammation. If the inflammation's not really addressed or just keeps happening over and over and over again, we get a lot of inflammation and swelling in the nose. But let's ask the question, why is it so important to breathe through the nose? Well, the nose is the only organ that is specifically designed to take in air, okay? If you think about it, you might not be aware, but there's these bones inside the nose. They're called turbinates. So you may have heard the term bony turbinates. They are designed to help warm the air and humidify the air before it reaches our lungs. Also inside the nose, there's little hairs and there's mucus inside the nose, and both of those things are designed to help trap and filter out particles that we breathe in. It helps to capture bacteria and viruses and allergens and dust and any other microparticles that might be floating around in the air. Those are just a few examples of things that can be filtered by the nose, okay? Not only that, though, and this is the part that a lot of people don't know, and I didn't even know this either until a few years ago. Inside our nose and in our sinuses in our face, we have the ability to make a gas called nitric oxide. A lot of professionals refer to nitric oxide as a miracle molecule, okay? And why is that? Well, nitric oxide, as I mentioned, it's created inside the nose and the nasal cavity. It has the ability to relax the blood vessels so that they can dilate or open. This improves oxygen delivery and even helps to boost the immune system because that nitric oxide has natural antibacterial properties, antiviral properties, antifungal properties, and it really plays a huge role in just our overall health and how our body is processing all of these bacteria and viruses and germs and particles that we breathe in constantly, okay? Quite literally, the nose is a use it or lose it organ. Let me say that again. Your nose, use it or lose it. This is me, and I'll explain a little bit later, okay? So, why? What do I mean when I say that? That's a big statement, right? I'm not the only one who says that, but it's a big statement. So if something happens along the way and the nose is not able to take in air as it should, the mouth then takes over. And so while it's true that we can breathe through our mouth, it's important that we understand that there is nothing anatomical about the mouth that is designed to take in air. Essentially, the mouth is an emergency hole in our face, right? So our mouth has many, many functions, and it serves as a backup function for breathing. So if we can't breathe well through our nose, the body needs to breathe. The mouth is the next best option, of course. So it's literally an emergency hatch, an emergency hole for breathing, okay? But if we allow that mouth breathing to take over, the nose starts to lose its function, okay? What happens is all the warming and filtering and humidifying of the air that our nose does now does not happen. And we're also not receiving the benefits of that miracle molecule, nitric oxide, that's going to help reduce the bacterial and viral loads going into our body to begin with. If we're not getting the nitric oxide, then the blood vessels, instead of enlarging and dilating, they're going to contract and shrink. We're going to have less blood flow, less oxygenation, and then things get tighter and it gets harder and harder over time for that nose to function properly. So what else happens if we lose good nose breathing, okay, and the mouth breathing takes over? We get more irritated and more inflamed when the air is bypassing that nasal structure for the reasons I just mentioned, the humidification, the filtering, all of those things. We also don't have the mucus and the hairs trying to help trap the stuff. The air goes in through our mouth, and then what happens is then the tonsils are taking the brunt of everything that the nose is supposed to do. So when we see a chronic mouth breather, typically they have had or do have very, very enlarged tonsils. Maybe they get lots of sinus infections or strep throat or sore throats or colds, all kinds of stuff, okay? Because now our nose isn't capturing all those particles. We breathe them in through our mouth, our tonsils trap them. Now it's great that the tonsils are there to do that, but that's not their main job. Their main job is to come in after all of these initial processes have been done first by the nose, and then the tonsils help to fine tune the process just a little bit. But if we're bypassing the whole nasal system and then the tonsils are taking the brunt of that, they are working much more harder than they are intended to. And then that itself can lead to more sickness and more allergies and more sinus infections and things like that, okay? So as this happens for a lifetime, okay, again, remember I said in the beginning that this mouth breathing pattern for a lot of people starts in early childhood. It's not just allergies and mouth breathing that can cause this to happen. Is there food allergies? Is there inflammation happening from milk or wheat or other ingredients that naturally cause an inflammatory response within the body? Okay, those things we have to take into consideration too. And then there's other structures. So I already mentioned the nasal turbinates. As we continue to breathe through our mouth, those nasal turbinates get big. So first, the mucous membranes or the skin on the inside of the nose start to swell and get big. And then eventually the bones themselves can start to get enlarged. And it can get to a point where you really can't even take air in through your nose. Even if you were to do all the things to try to clean your nose and get it working again, if those bones are becoming so large that you can't take air in, there's not much that's going to help without maybe having to see an ENT and considering a surgical procedure. Doesn't mean it always comes to that, but that's something you have to keep in mind. All right. The other thing, we mentioned that the tonsils get really large. If you're a child, you also have adenoids. As adults, the adenoids shrink away, and it's not something we really have to think about. But in a child, the adenoids are directly behind the nose. And this is another like structural thing that can prevent air from getting into the nose. So say your nose is open, it's clear, the nasal turbinates are fine, the air goes through the nose, and then it hits the very back of the nose where you have that big soft tissue, the adenoid tissue, which is similar to tonsils, okay? with mouth breathing, again, just like tonsils, those adenoids get very swollen, they get very enlarged, and they can quite literally be the reason that you can't breathe through your nose or your child can't breathe through your nose. And then if the tonsils are big, so you have this whole like system, this airway, right? That's essentially what we're talking about is the airway that is being blocked and obstructed by soft tissue or hard tissue with those bones. So we need to make sure that those things are not causing a problem. When people come for myofunctional therapy, that's one of the things that we need to first determine is, can you breathe through your nose? Now, we aren't doctors. We're not taking images. We are not diagnosing anything, but we have maneuvers and different types of really simple screening tools to help us figure out, is your inability to breathe through your nose due to a structure issue? So if you're breathing through your mouth all the time, is it due to a blockage somewhere along the line in your airway? Or is it a habit? Because a lot of times that is also the case, all right? You've become so acclimated to breathing through your mouth that that's really all you know now. All right. And even though you're breathing through your mouth, you might have some inflammation or enlargement of those tonsils or the mucous membranes inside your nose or the turbinates, but maybe they're not so enlarged that it actually prevents you from breathing through your nose. It's kind of two different situations. So when I ask you to do certain things when you're in my office for your initial evaluation, I want to try to determine, is your chronic mouth breathing because of a structural issue? Or has it become a habit and you're just so used to it? With that, let me tell you about a little bit about myself, okay? Because this is me. Everything I'm talking about is me, okay? So I've had terrible, terrible allergies my whole entire life. You name it, I have it. I've had the skin poke tests, the allergens. They usually poke you 50 times. When you're a kid, they do it on your arm. When you're an adult, they do it on your back. And of those 50 things, I reacted severely to 48 of them. Okay. The two things I did not respond to was, I think, rabbits and guinea pigs. But everything else I have a very severe reaction to. Every kind of pollen, grass, every tree there is pretty much. The dust, the pollen, the mold, the cats, the animals, everything. Um, so I've spent my whole life being the kid that's sneezing, itchy eyes, watery eyes, just miserable, just snotty, disgusting kid. Okay, so that was me. And we could probably all think of someone in our head right now that comes to mind as that allergy kid, right? I grew up in the 80s and 90s, and then it wasn't as common or accepted, maybe is a better way to say it, for kids to be taking medicine the way we do now, right? So it wasn't common for a kid to pop, Zyrtec every day to control their allergies. So I suffered. I suffered and suffered and suffered, and pretty much life sucked because I was just always miserable. Um, so let's fast forward. So I had lots of ear infections when I was little. I had lots of strep throat, tons and tons of strep throat all the time. Eventually, all the things I just talked about started happening to me. My nose got so enlarged inside, those turbinates were so big that I literally couldn't get air through my nose. Okay. And when I was 28, my tonsils were so humongous. I had taken antibiotics for about 6 months in a row to try to treat sinus infections that wouldn't go away. My tonsils were so huge that at age 28, I finally said to the doctor, I'm like, I cannot do this. I'm getting strep throat constantly. I am sick all the time. We need to take these tonsils out. And it was a pretty horrible experience. I'm not going to lie. We've all heard that, when you have your tonsils out as an adult, it's hard. And it was extremely hard. I mean, I could talk a whole episode just about that experience, but it was rough. Am I glad I did it in hindsight? Absolutely. Yeah, because that was the first step that really started to get me into good nasal breathing ability. You have to have the ability before the actual function of it takes over. So 28, I had my tonsils out. And then let's see, 28, 29. So 5 years ago, I then had sinus surgery. And this was another thing. Okay. So now I'm in my late 30s and I had sinus surgery. And what did they have to do now? Okay. So my tonsils were out, but I still couldn't breathe through my nose all these years later. And I didn't know I was supposed to, honestly. We'll talk about that too. Um, my nasal turbinates were huge. My sinus cavities in my face were so big and so full of crap that there's no amount of antibiotics that were going to get rid of it because it can reduce the severity of it, but it never, they were so inflamed that there was no way for the discharge to actually drain out of my face, out of my sinuses. So essentially there's this infection that's festering in your face for 6 months. That was my case. And it just got worse and worse and worse. Fevers. I mean, I was sick all the time because my body is trying to fight this infection. And then my stomach was a wreck because I was taking antibiotics for 6 months. It's like, all right, something's got to give here. I can't keep living like this. So again, I had another conversation with the doctor, went to the ENT. We got surgery scheduled. Bam, they drilled out basically my nasal turbinates. They opened up all the sinus cavities. They put little balloons all the way up through my nose, up by my eyebrows to enlarge those frontal sinuses. And that made a huge difference. I could finally breathe. But guess what? Here's the kicker. I still mouth breathed all the time. That doesn't make sense, right? What I'm saying. So now everything's been removed and opened and drained. All the stuff is working the way it's supposed to. And I'm still a mouth breather. Why? Because I didn't know any better. No one ever told me. It wasn't until I learned about myofunctional therapy and I started getting down this world that I realized, like, hey, I'm supposed to breathe through my nose. My nose is what is designed. And I knew this stuff about the nose. Most of us do, right? Filters, it warms the air, traps the bacteria, blah, blah, blah. We all know that. We have a general idea of that. But no one told me, hey, you can breathe through your nose now, so start doing it. My ENT didn't even tell me that. My ENT, my ear, nose, and throat doctor did not tell me, hey, guess what? You can breathe through your nose now. Do it. A lot of them don't understand that, the function of things. Like they are smart guys, ladies and men, and they are highly educated. They are great at fixing structure, right? If something's wrong or there's something in the way, they're good at fixing it. But they don't always understand the why part, like the function of it. So it's nobody's fault that I didn't know I should breathe through my nose. It's just, it wasn't the priority to have that conversation. They fixed me, and that's what I was happy about. Now I've gone through myofunctional therapy. I've learned how to put my tongue in the right place. My body knows how to breathe correctly. I can control my airflow. All my muscles are strong in my face, my tongue, and my throat. And I am amazing. I sleep amazing. I feel great. I have lots of energy. And really, the myofunctional therapy was the part that got me past that ledge of not knowing. I didn't have the education, I didn't have the knowledge. So if I never stumbled into this world, I could still be sitting here being a chronic mouth breather, and then some of those issues might start to come back again. The other thing that is really improved is the severity of allergies. So let's talk about allergies for just a minute because you can't really get rid of them, right? You can have immunology department can like formulate things for you and you can do lots of injections and things, but I thought about that at one point so that my body can try to like learn how to not react to these allergens. It's a very, very long and expensive process and it doesn't always work. I've experienced many clients that have actually gone through that process and it maybe helped for a couple months and then the allergy response came right back. So not knocking it by any means, but just really do your research before you dedicate because there's allergens everywhere and there's stuff that you are probably sensitive to that you weren't tested for. So as long as there's an allergy response happening, you're going to have inflammation, you're going to have stuffiness. So it's really hard to control. I like to use a certain product in my nose that helps with inflammation. If you have questions about that product, reach out to me and we can have a conversation about it. But that's been a life changer for me, helping to control the inflammation. So the allergies are still there, but my body has a better ability to take care of it now, which is really, it's been life changing. I'm not going to lie. Okay, so if we just keep living our life and we don't address the issues and we just keep mouth breathing, that changes everything. I mean, symptoms get worse. I just told you my whole story. Symptoms get worse, you get more miserable. The other part we have to think about too is that, all right, so what are the consequences of just letting it be and not doing anything about it if you can't breathe through your nose? Mouth breathing is going to change the bacteria in your mouth. You're going to probably have more cavities. Maybe you're going to need more crowns. If you're a child, the whole facial structure growth cycle of your face is going to change. And instead of growing nice and wide and broad like it should, it's going to go long and tall. And then we're going to have a whole other set of issues to deal with kids. And then we then see as adults, and a lot of those adult clients come see me for myofunctional therapy, and we try to undo their whole life of bad habits with mouth breathing, okay? So those are just a few of the things that happen. We tend to snore more. We then maybe have more of a likelihood for sleep apnea. And the severity of everything we deal with just gets worse as we get older if we don't address what is causing the issue and how to repair it, okay? So in a nutshell, that's a bit of an introduction to why nose breathing is so important. And when the mouth takes over, all of the different things that happen and can stem from it. Okay. So I would like to talk to you. If you have questions for me, visit our website, myofunctionalpathways.com. Let's schedule am I a chronic mouth breather? Discovery call. And let's talk about your symptoms. And it's a free call, a free Zoom call. Reach out. You can schedule that on my website and let me know if you have any questions. As always, thanks so much for listening. We'll catch you next time.
And now for the fine print. The information presented in this podcast is for educational purposes only and should not be taken as medical advice. We recommend consulting with a qualified healthcare professional for any questions or concerns you may have regarding your specific health condition.